Good afternoon. I am John Kelly, publisher of the Orlando Medical News. Today we are blessed to visit with Dr. Moin Kola. He is a gastroenterologist practicing medicine in Orlando, Florida at the Digestive and Liver Center of Florida. Dr. Kola is board certified in gastroenterology services. He has practiced, as I said before, for 10 years. He completed his gastroenterology fellowship at Case Western Reserve University and the Inflammatory Bowel Fellowship with Crohn's and Colitis Foundation of America at the Cleveland Clinic. Dr. Kola served as Chief Fellow during the last year of his fellowship training. Dr. Kola began his gastroenterology training in England and holds the distinction of being a member of the Royal College of Physicians of the United Kingdom. Dr. Kola was actively involved in clinical and basic science research during the course of his fellowship. He has published his work in the national and international peer review, gastroenterology, and hepatology journals. Dr. Kola has expertise including colon cancer screening, gastroesophageal reflux disease, peptic ulcer disease, inflammatory bowel disease, celiac disease, irritable bowel syndrome, fatty liver disease, and various other gastroenterology and liver disorders. Dr. Kola is a member of the American College of Gastroenterology and American Society of Gastrointestinal Endoscopy. Welcome, Dr. Kola.
Thank you, John. Good to be with you.
Dr. Kola, can you explain to our audience what gastroesophageal reflux disease, otherwise known as GERD, can you share what that is?
Sure. Thank you, John, for that question. Gastroesophageal reflux disease, which is commonly called as GERD, is a chronic disease that occurs when the acid, which is normally present in the stomach or bile, flows into the food pipe or esophagus and irritates the lining of the esophagus. So that, in a sense, is what gastroesophageal reflux disease is.
Can you share what type of symptoms GERD exhibits with patients?
Sure. There are two kinds of symptoms. One is what we call as a typical symptoms of GERD, and the other type of symptoms are called as atypical symptoms. The typical symptoms of GERD is burning in the chest, especially after eating, which may be worse at night. The other symptoms are regurgitation of food up to the back of the throat, chest pain, a sensation of lump at the back of the throat, and occasionally difficulty swallowing. The so-called atypical symptoms of GERD is cough, especially at night, wheezing, and occasionally hoarseness of the voice. But by far, the most common symptoms is burning in the chest, aggravated typically after meal or worse at night upon laying down in bed.
That burning in the chest, Dr. Kola, is that sometimes mistaken for some type of heart problem?
It can be. So when a person develops chest pain, regardless of the nature of the pain, be it a burning pain, a sharp pain, or a tightness, the first advice we as physicians always provide to the patients is to seek medical attention to ensure that the pain is not coming from the heart, which can be far too dangerous than the pain originating from the gastrointestinal tract. So yes, it's very important that some of the symptoms of GERD could be mimicked by heart symptoms, which is why the cardiac issues needs to be ruled out first before we turn our attention to the esophagus.
Understanding that many of the symptoms of GERD can be overlooked or just ignored, patients do not seek appropriate medical follow-up or attention. What are the long-term effects of untreated GERD?
Sure. GERD is very, very common in American population. And typically, most of us have had once or twice in our lifetime, depending on what we eat. But what's important here is to realize that if a person is getting symptoms too often, then it can lead to long-term complications. So the long-term complications of untreated GERD is inflammation of the esophagus called esophagitis, ulcers in the esophagus called esophageal ulcers. You can get narrowing of the esophagus called strictures, which can stop you from swallowing food. And then it can lead on precancerous changes in the esophagus called Barrett's esophagus, which eventually leads to esophageal cancer. So these are the dreaded complications of untreated GERD over a long period of time.
How can you screen or test for GERD?
Well, screening for GERD starts typically with the patient. So if a person has symptoms which is suggestive of GERD, that's when he or she seeks medical advice. In terms of the diagnosis, there are two diagnostic tests which can be performed to diagnose GERD. First one is an upper endoscopy, and the second test is called esophageal pH monitoring. So the endoscopy, which is typically called EGD, is a procedure which is used to visually examine the upper digestive tract, meaning esophagus, with a tiny camera that is at the end of the long flexible tube. It allows us to look at the lining of the esophagus to see if there's any damage to the esophagus as a consequence of GERD. The other test, which is considered as a gold standard for diagnosis of GERD, is called 24-hour pH testing, which is again performed as an outpatient procedure where a small device is attached to the lining of the esophagus with the help of an endoscope. And this device measures the acid flow into the esophagus over 48 hours, which can then be downloaded on the computer and studied by the doctor to see if a person has significant gastroesophageal reflux disease.
Do you have any idea of the percentage of the U.S. population that experiences GERD?
Up to half of the population would have experienced at least once or twice GERD symptoms in their lifetime. But typically, 20% of adult U.S. population has chronic GERD. So it's 1 in 5 adult in the GERD in the U.S. has significant chronic GERD.
That's a significant percentage. I don't want to ask this question twice, but I think it's important for our audience to understand. When should a patient seek medical advice if they're experiencing these symptoms of GERD?
That's a very good question, John. So every person should seek a medical advice when they have following symptoms. If they have frequent episodes of GERD, if the symptoms are persistent and not responding to the over-the-counter medications like Pepcid, Prilosec, and so forth, if they have difficulty swallowing, example, if the food gets stuck in their throat or in the chest, if they start to lose weight, if they have any signs of bleeding, meaning vomiting blood or passing blood through a rectum, or if they have persistent vomiting. So these are the bad signs indicating potential complications from underlying GERD that should make an individual to seek medical attention.
Well, doctor, this is awesome information for our audience. If our audience would like to reach out to you and visit with you or seek information, how can they reach you?
Sure. So they are welcome to visit our website, which is dlcfl.com, or they can call our office at 407-384-7388. Thank you.
Great information, Dr. Kola. I cannot thank you enough. Have a great day.
You too, John. Thank you for doing this.